Queensland. Right, we've got a bit to get through today, so I ask you for your patience and your understanding. So, first of all, I want to thank everyone for wearing their masks. Please keep doing that, and the 15,000 people who got tested in the past 24 hours. As I said yesterday, we're not just fighting one outbreak, we are focusing on a number, and some more information has come to light today that I'll get to in a little bit later. But we are now dealing with some multiple scenarios that it's time for us to act quickly and to act fast. So we have 4 new cases, 2 are overseas acquired and 2 are in the community. Now, one is a minor from Ipswich, and they are one of the 170 from the Northern Territory detected in home quarantine. We considered this person to be of low risk, so that's good. And of those 170 that have been contacted, remember yesterday we talked about the 170 workers, 114 have been tested and 112 are negative. So the 2 positives, it's the woman from Bly and this latest case from Ipswich. Now, there's another case that we are very concerned about. And I want to go through this in some detail, but Dr Young will go through it in even more detail because it affects not just parts of South East Queensland, it affects regional Queensland as well. So there is a young woman, a 19-year-old casual clerical worker from the Prince Charles Hospital. Now, she lives at Sandgate and she has visited Woolies and a gym. Dr Young will give more details there. She works at a receptionist outside the COVID ward. She is a casual worker. She has travelled with her family between her home in Sandgate to Magnetic Island in Townsville at the end of last week. She also attended the Sunday markets in Townsville. She was tested yesterday and the positive result has come through. Now, there's all that genomic sequencing that is happening at the moment, so Dr Young will get that through later on this afternoon. So we don't want to say what strain it is at the moment because we don't simply know. Now, one of her close friends is sick, they're getting tested, and 2 of her family members are sick and they are getting tested. And despite the health directives that she should have been vaccinated, she was not. So the Health Minister will be addressing that issue in more detail. And let me say I am absolutely furious about this. We need to make sure that we are getting our population vaccinated right across the state. Now, this leaves us with no option. I foreshadowed yesterday that if we've got these multiple issues happening across the southeast and now some risk exposure in Townsville, regional Queensland. We've got that outbreak, that risk linked to the Portuguese restaurant we mentioned the other day. We've got the flight attendant from Sydney who came up on multiple flights. There's a lot of contact tracing happening there. So the risk is real and we need to act quickly, we need to go hard, we need to go fast. So I want to just say to everyone, I know we're in the middle of school holidays and I know people have made plans, but we've just got to do this. And we've got to do this for 3 days, so there'll be a lockdown for 3 days. And I don't want it to be 30 days, so we just have to do this. So from 6 p.m. tonight until 6 p.m. on Friday, South East Queensland, Townsville City, Palm Island and Magnetic Island will go into lockdown. South East Queensland includes all of the 11 local government areas listed yesterday. And one of the prime reasons for that, as advised by Dr Young, is because we have had those flights that have come in to those areas, and plus now with this issue as well. And what we want to do is we want to give our contact tracers time to get on top of this. This is absolutely essential, and we want to make sure that we stop the virus in its tracks. So this is really important that everyone does the right thing. And I know Queenslanders will. I know these are tough decisions. We've had 2 extensive meetings this morning about this. We have to take the advice of Dr Young. I have accepted that advice. Okay, so now we'll be setting up fever clinics on Magnetic Island and in Townsville. I urge people in Townsville, especially if you're at the Sunday markets, to get tested, and Dr Young will give you the date of that. And like I said, we want to stop this virus in its tracks. The Deputy Premier will go into this a bit more detail, but look, I am still concerned about the large volume of overseas travellers we have coming into our state. We are getting on average 150 a day. I think it's about 190 that are coming in today. Hotel quarantine is just not the answer. We need a massive reduction in overseas arrivals because the overseas arrivals are bringing in these contagious strains. We need to get on top of this. We've seen what's happening in Sydney, in Western Australia, in the Northern Territory, and I am just urging the Prime Minister, reduce the caps. We should be utilising Howard Springs. I noticed that Dan Andrews has said something about this morning as well. I absolutely back that in as well, and both Dan and I raised at National Cabinet the real need to lower the caps to reduce the risk. The reason why we're having lockdowns in major cities is because the overseas arrivals are bringing the virus here, they're going into hotels, and all of our staff are having to deal with it. There are so many staff involved, the risk is real, and we need to contain the virus. We need to protect Australia, we need to protect Queensland. The final thing I just wanted to say is that I know this is going to be tough for a lot of families. I apologise for that, but I don't want to see people end up in our hospital on ventilators. That's the last thing I think anyone wants to see. We have a large proportion of our state unvaccinated. The federal government is in charge of supply of that vaccination, and we know that it's all coming in the last quarter. Until that time, there is a real risk. And until that time that the large proportion of the Queensland public are vaccinated, we should massively reduce the number of returning Australians. It should be for genuine hardship reasons. The federal government would know who those people are, but at the moment there is a large number of exemptions that have been given for people to come in here rather than returning Australians. So I might leave it there because Dr Young needs to go through some details, because we want to make sure that people who've been to some of these exposure sites can go home and get tested.
Thank you, Premier. So 4 new cases in Queensland overnight, 2 of them in hotel quarantine, and they acquired the infection overseas, 1 from Slovenia, the other we're still tracking the travel history of that person. Then 2 community-acquired cases. One of them is one of those miners who returned from the Tanami mine in Central Australia and returned home to Ipswich area and was immediately tested when they came. We did 1 test on that miner, and at that stage it was equivocal. So it was really early in their illness, and we wouldn't call that a positive. Then we repeated the test later, and at that stage it was definitely positive, which means the first test when they first went into quarantine was very, very early, which means I hope that that is low risk. But we do know it's the Delta variant, so we'll be contact tracing everyone on that plane, everyone that miner's been near. Now, we've got hold of all of the other miners across the state, and we've got them in quarantine, and we'll be testing them, but we're not out of the risk time yet with all of those other miners. So that is a continuing risk for Queensland. Then the other case is a brand new community-acquired case that at this point in time I can't be definitive how they got it. I should get genome sequencing by the end of today, early tomorrow at the latest, and then I'll be able to work out where they've got it. Because we do have that alpha variant circulating in our community because of the Portuguese restaurant cluster that we've got evolving, but also this particular individual worked as a casual and they sat outside the COVID ward at the Prince Charles Hospital. So there might be a link there, but genome sequencing will tell me what's occurred and where that risk is. So we now in Queensland have 4 incidents that are concerning me. We have those miners who've returned from the Tanami mine. We have those 5 flights that crew member was positive on with Virgin Airlines, and although only 2 of them came into Queensland, we know the other 3 potentially had Queenslanders on board who have then come back into Queensland. So I'm worried about all 5 of those flights, and we're working through those. Then we've got the Portuguese restaurant cluster, and I've still got 1 case there that's unlinked epidemiologically. It's linked through genome sequencing, but I don't know the exact person that they got infected by. So I'm worried that there might be a case out there in the community that I don't know about. Then I've got this 4th case that may be linked to that case through the Portuguese restaurant cluster, or it may be linked to one of those overseas travellers that's been admitted to the Prince Charles Hospital, or it could be another linkage that I've just got to work through. Now, this case, I need to go into detail where they've been. So they first developed symptoms last Monday, over a week ago, and they've been infectious then from 7 a.m. the Saturday. They've been out, they live in Sandgate with their family household. There's 4 other people who live in that household, and they've been to the Sandgate Woolworths. This is so important. I'm going to refer to some notes, but we will put all this information on our website and we'll put it out in a press release. So at this stage, but please remember, I only found out about this when I got up this morning at 5:30, and we've been furiously trying to get more information. So it will get clarified through the day. But I want to give people a heads up. So Sandgate Woolworths, 9:30 to 10:30, Sunday a week ago, and the Bay Health Gym from 10 to 12 on that Sunday. Then they worked a shift at the Prince Charles Hospital from 3 p.m. to 10 p.m. on the Tuesday and Wednesday last week. Then on Thursday they went with their family on VA 369 from Brisbane to Townsville on Thursday the 24th at 10 a.m. They were in the Brisbane airport for 1 hour prior. Then, when they landed at Townsville Airport, they were at the Cafe Brewery in the airport there for 1 hour before travelling to Magnetic Island. Then they spent from midday Thursday to midday Sunday the 27th at Magnetic Island. So I'm asking every single person, I understand there's about 2,500 people on that island, to come forward and get tested, whether or not they've got symptoms. That's really important, and we've got a fever clinic there on the island. Then on Sunday the 27th, they travelled from Magnetic Island back to Townsville. They went to the Sunday morning markets in Townsville City late morning. Then caught V8 374 from Townsville to Brisbane on that Sunday the 27th, 2:55 p.m, then came into Brisbane Airport. Now, I know I've had that mandate mask wearing in airports throughout for many months now. It is absolutely critical. So people who are in the airports around those times, if you've got any symptoms at all, hopefully you were wearing a mask so you're safe, but any symptoms at all, you've just got to come forward and get tested. So we'll put out more specifics when we get that about where this lady might have been. So 2 of her family members who live in the same household are unwell, so we're urgently testing them, of course, and 1 of her close friends is unwell, so we're urgently testing them. So we'll get all those results through the morning and make sure we get that information out there. So that is critical. It is a significant risk, which is why, as of 6 p.m. tonight, which I recognise is very little notice for people, but at 6 p.m. tonight, the 11 LGAs that we declared from 1 a.m. this morning to have those increased restrictions will go into lockdown with only those 4 reasons that everyone knows so well as to why you can leave your home, and that will be in place till 6 p.m. on Friday evening, unless there are issues in the past. As you know, we always review that on that last morning to work out what needs to happen. Thank you.
Right around the country right now, there is a lot going on with this pandemic. In Sydney, in Perth, in Darwin, multiple outbreaks now here in the southeast, and for the first time in some time, potential exposure in regional Queensland. All of them can be traced back to international arrivals. In fact, every day we have new cases in hotel quarantine from people who have travelled from overseas. Our international borders are supposed to be closed. Our international borders are supposed to be closed, but every week thousands of people are allowed to travel. 190 international travellers arrived into Queensland yesterday. 121 international travellers arrived into Queensland yesterday. 190 are expected to arrive today, and these are putting our community at an unacceptable risk, especially with these new strains which cannot be contained, which have proven they cannot be contained by hotel quarantine. Similarly, our community should have had a higher rate of vaccination by now, and we should have dedicated quarantine facilities. And as the Premier has indicated, we will now move to dramatically cut the number of international travellers permitted to return to Queensland. The nation only has one dedicated quarantine facility at the moment, that being Howard Springs, and it is our view that that should be where international travellers return to until there are additional facilities. Regarding the Commonwealth's proposal of a quarantine facility at Pinkenba, I can confirm that we have been invited to participate in a proposal to assess the feasibility of the suitability of that facility. So we don't even know yet whether it is feasible or suitable. We will do that work. We will work with the Commonwealth to do that work, but in the meantime, we have to cut the number of travellers arriving until we have our community vaccinated and dedicated quarantine facilities. I want to assure Queenslanders that we are doing today what we have always done. Making decisions that are sometimes difficult, but making them on the basis of the health advice in order to keep Queenslanders safe. We will not risk waiting too long to act. We will act when we are advised to do so, and that is precisely what we are doing today.
Thank you. And as we know, we must act hard and fast to trace and contain. New South Wales has just reported 19 new local cases, 2 unlinked. Queensland, we're reporting 2 new local cases, but we cannot wait. We know that there's 4 outbreaks or potential outbreaks that are putting Queensland at risk right now, so we must take these measures. To go through the 4 essential reasons, once we go into lockdown across the 11 local government authorities in South East Queensland, plus the Townsville City Council local government area, which includes Magnetic Island and also Palm Island. We'll go into lockdown from 6 p.m. this evening till 6 p.m. on Friday. You can only leave your home for one of these 4 reasons: essential education and work that cannot be done at home, or to obtain health care services, including getting your vaccination, care or support of a vulnerable family member, essential shopping in your local community, or exercising with no more than 1 person not from your household in your local community, obviously outdoors, because indoor gyms will be closed from 6 p.m. Further restrictions, which will all go up on the website: 20 people can attend funerals, 10 people can attend weddings, no dancing or singing. Of course, a lot of these venues will be closed anyway. Limit of 2 visitors in homes, in addition to people already residing in the home. So again, we make sure you do not have people visiting your home at this current time. Restaurants and cafes will only be allowed to provide takeaway or home delivery. Cinemas, entertainment venues, recreational venues, beauty and personal care services, gyms, etc. will all be closed, in places of worship. Please, if you are going and getting food, including takeaway, you must use your QR code. And most importantly, get tested. This young lady was symptomatic since Monday week ago. 10 days in the community, infectious since last Saturday, the 19th. So we need people to take this seriously. If you are unwell at all, any symptoms, you must get tested. We will make sure that we are watching our testing clinics very closely, and if need be, we'll make sure we've got surge capacity and pop-up clinics. We'll make sure we've got testing happening at Magnetic Island, and of course we are working with testing clinics in Townsville right now as well, including private pathologists, and also that we will be requesting that the Commonwealth allow their vaccination centres for people without a referral. So please keep a watch on the website. We will have new exposure sites being listed as the interview continues with this young person, and also as we get results on close contacts. In relation to international travel, can I say that we know about half of the people who are coming in on international flights are not Australian residents or citizens. We also know many people are being allowed to leave Australia to go overseas and to return quite frequently. And in fact, some of our recent clusters, including the family who had gone to India, had been allowed to go over to India from Australia, from another jurisdiction in Australia, and return via Brisbane, and we saw transmission happening there. So we ask everyone to be vigilant. Social distancing, hand hygiene, wearing your masks. We know what to do, we've done it before. We need to make sure we are being extremely vigilant at this difficult time. We know that Queenslanders are up to the task, and we thank you for everything you're doing. And of course, keep getting vaccinated. We want as many Queenslanders vaccinated as possible, and our vaccination clinics remain open. Thank you.
Thank you. May I start by saying that when we've done this in the past, we've always achieved the outcome that we wanted because the community has worked with us in doing that. So we're really asking for that again. For those 11 LGAs, Townsville and Palm Island, please work with us and understand what was required of you. We will be adopting our police a high visibility presence as we've done in the past, so you must have the reasons to leave your house in order to go out. We will be checking that, and of course you'll need to be wearing a mask. So I have to remind you that there is a $200 fine for not wearing a mask if you have no lawful purpose or excuse, and also for not following the Chief Health Officer's directions around whether you can leave your home or not is a $1,334 fine. So we want to work with our community and not see any fines have to be handed out. Can I also mention with the borders that the posture remains the same, so we're not seeing hard road border closures at this stage. We are monitoring the situation very closely, but for anyone that is travelling at the moment, they need to be aware that there are now increased hotspots in West Australia and Northern Territory, and that will impact on returning to Queensland in terms of quarantine requirements, so please be across that. I also want to remind everyone that if you leave the 11 LGAs currently under restrictions before 6 p.m, you must abide by those restrictions if you are outside the lockdown area for the remainder of the period. So people need to be aware of their obligations. As I said at the opening, please work with us on this and we'll get a great outcome. Thank you.
Thank you, Deputy Commissioner. I might just update also, Western Australia and Northern Territory have extended their hotspots. So we will be putting in place travel restrictions for Perth and Peel, and also in the Northern Territory, Darwin, Palmerston and also Litchfield. So from 1 a.m. tomorrow morning, you will only be able to come into Queensland if you are a Queensland resident from any of those hotspots, and you will need to go into hotel quarantine. For anyone who is not a Queensland resident, you will need to apply for an exemption, and if you are granted an exemption, you will need to go into hotel quarantine. So that will take effect from 1 a.m. tomorrow morning, and that will stay in place while those states have those declared hotspots. Thanks.
Premier, you said a lot of you were curious that this worker wasn't vaccinated. Queensland's health responsibility to make sure that people working in the hospitals are vaccinated. What are you curious at?
Well, the directive said that they actually needed to be in the ward vaccinated she was located outside the ward, so for some reason she wasn't vaccinated. So there will be a full investigation into that. But let's just say this virus is contagious. It is hard to contain it in hotels and it's hard to contain it in hospitals. I mean, that's the truth of the matter.
When you say she was outside, was she immediately outside the ward or elsewhere in the hospital away from it?
My understanding is outside the ward. So they've got a dedicated facility to looking after COVID people. So if someone tests positive in a hotel, we take them to Prince Charles as one of the hospitals, and it's a dedicated area.
Associated with COVID
Yes.
ward.
Yep.
So,
Yep.
and you said I think 4 other family members she was with at the same time? The two who are sick?
Yes. So there's 2 family members that are sick and someone else.
Do you know
So
their relationship with this?
no, we'll find that out for you. As I said, this has just come to hand early this morning. Dr Young has provided us with the advice. We've had 2 extensive meetings about this. This is why we're acting very quickly.
When are you likely to know what variant she had?
This afternoon, so we'll get that to you this afternoon. We've got urgent testing. Sorry,
Can you idea how many other people in Queensland hospitals are not vaccinated?
I don't have that information.
Why not? Isn't that something that the government should know, how many people work in the hospital?
Well, we're working through 1A and 1B, and then it's up to the HHSs to administer that. So we can get that information for you.
Was the friend who is sick a nurse at the hospital or just a friend?
I don't have that detail.
And the household people, were they all travelling together? Like, did they go up north together?
My understanding was a family group that was travelling.
What,
And did she come forward with testing? How did that all come about?
Yes, she recognised she had symptoms and she came forward and got tested. Yeah.
what level of vaccination would it be 50% of the population vaccinated before we avoid any more lockdown?
I think step 1 is that we need to look very carefully about our overseas arrivals. And until we have a large proportion of the Australian population vaccinated, we should be halting or reducing dramatically the number of people. They should only be coming here for genuine reasons and should be quarantining out of, as I've said, look, I've said this before, you should not be quarantining people in hotels along the eastern seaboard. But you've also seen what's happening in Perth, and that way you would avoid the lockdowns because you've got all the staff and everyone who's involved with people, and that's where your dense populations are. So it's a high risk.
Going to reduce the caps or the numbers coming in. Can the Queensland government do that? The National Cabinet.
I raised that at National Cabinet. Victorian Premier raised it at National Cabinet. There's another meeting later on this week of National Cabinet. Look, we've got to act now. I mean, that is a national issue. The federal government has control of that. They can do that immediately to alleviate the pressure that you see the states are under at the moment. And it's a lot of pressure that the states are under. The hotels are full or nearing maximum capacity, and they are not meant to fight infectious diseases. And we're seeing now that even in COVID wards, it is so hard to contain this virus. This highly infectious.
Was the decision to vaccinate under 40 with AstraZeneca made at National Cabinet last week?
The only decision that I recall being made is that the federal government was giving indemnity to the doctors, so people would have to go and speak to their doctors. But you know, we've had advice from ATAGI, and we should be following. I think we should be following that advice.
It's not about the National Cabinet. What's the main thing that you think needs to be delivered by the federal government now?
The vaccinations, the vaccines, that is absolutely imperative. I want to see as many Queenslanders as possible vaccinated. I mean, we do such a good job, and Dr Young talks about this, with our immunisation of young babies and people getting their vaccines throughout their life. But this is really important because this virus is around, and what you've seen from New South Wales too, the people who attended that party, if they were vaccinated, they didn't get the virus. So it doesn't mean you still can't transmit the virus, but I think these are really important issues that need to be addressed.
During the lockdown,
Sorry?
What response did you get from the Prime Minister to your calls to cut arrivals?
We were going to discuss it on Friday, but I'm calling for it today. I mean, it's putting so much pressure on so many of our population and our people in dealing with hotel quarantine, transportation, hospitals. It's too much pressure. There is a regional centre now, Howard Springs, that works. It is away from the densely populated cities of Australia.
Did you say, sorry, Premier, that you and Dan Andrews raised the national?
Correct.
Do you think the vaccine should be compulsory for all Queensland health workers?
Sorry?
Do you think the vaccine should be compulsory for all?
I think we need to have a discussion about that. I think there needs to be a discussion about FIFO workers and flight attendant workers as well. I think we need as many people vaccinated as possible.
Do we, during the lockdown for the 3 days,
Yes.
people from Brisbane go to the Gold Coast?
No, they should be staying in
So
their
is there-
community.
So is there a limit on travel from your home as has been?
There has been, unless it's those essential reasons.
What is the distance you can travel from your home?
I'll let Dr. Young.
Thank you. There are only 4 reasons you can leave your home during the lockdown period. One is essential work that you cannot do from home, or essential study that you cannot do from home. Now, we know that our school kids are on holidays at the moment, but if there are people at TAFE or at university, if they've got essential study that cannot be done from home. And you can travel wherever you would normally travel to do that essential critical work, essential critical study. So you can leave home for those reasons. You can leave home to care for someone. If you have responsibilities to provide care to someone who's vulnerable, you can leave your home to where that is. Then, of course, you can leave your home to buy supplies, essential supplies. So that's food, that's medications, so things that are essential. And you can leave home for your own essential healthcare, of course, for any healthcare, and to get vaccinated. But you are doing all of this with a mask on. So when you're going to get vaccinated, you'll have a mask on. When you're going out for essential work, for care of anyone, you'll have a mask. And then the last reason is for exercise. That should be done locally. We've already done this before. We all know exactly what to do. So that should be locally. It won't be indoors, it won't be in gyms, it'll be outdoors, and you can do it with your own household members or with one person from outside your household. Plus you can have 2 visitors to your home, including children. 2 visitors, that's it. On top of whoever's there today. So this is holidays, if you've already got people in your household that have come to spend time with you, they're part of your household for this period, and then you can have maximum of 2 people. So it's really limited. We need people to not move around. And please, I know it only comes in at 6 o'clock this afternoon, but I really don't want to look out there and see people just wholesale moving. You should now finish your day wherever you are, at work, wherever you are, and go home. You shouldn't be then leaving your area and going away.
So until we get some receptionists to work 2 shifts at the hospital while infectious, what's happening to all the staff at Prince Charles?
Right, so far we've contact traced that she had interaction with 2 other concierge workers. That was the service she was providing, and 1 janitor. Now this, please, is very, very early. We've been doing all of this work this morning, so we need to now go and confirm it. But she was in the part of the hospital that has been put aside only for COVID patients. It's quite separate to the rest of Prince Charles Hospital, so the rest of the hospital shouldn't be at risk. Because I did this some time ago because I wanted to stop the risk of having whole hospitals shut down like Prince PA had to a while back.
What's the risk factor like for North Queensland?
Well, I don't know. So I'm just being very, very cautious because we're in the middle of a holiday period. We've had a lot of movement up there, so we're just asking everyone to come out and get tested at Magnetic Island, and anyone who's been to those Sunday markets there in Townsville, and anyone who's been around there with symptoms as well. And then by the end of today, I hope, we've got a fantastic service here in Queensland. We get genome sequence results so fast. It normally takes 24 hours. I hope to get that later today. But we still don't have a genome sequence result for that miner in Northern Territory, for instance. So we've got a really fast turnaround here, but I have to wait for that before I can determine exactly what the risk is.
What's on the Gold Coast that were added overnight?
Yes, so I'm worried about that flight that came in with that infected flight crew member from Sydney, if you remember, that flew from Sydney to the Gold Coast. So I am concerned. That's why the Gold Coast is included in the LGAs of concern. Yes, that flight crew member had Delta. Has Delta.
The woman from Sandgate, she flew back into Brisbane on Sunday.
That's correct.
55.
Yep.
She tested positive yesterday.
She had her test done on Monday.
Right.
And then we got the result back this morning.
So she hasn't been anywhere else in the meantime?
Well, I hope so, but that's all what I've got to go and check. So I'm just giving the very first information where I know there are risks. There will be more risks, and we'll put that up on our website. So I ask that everyone keep on checking our website for all those venues of concern. There will be more. Plus, there are a number of her close contacts who are unwell. They could be unwell with other cold illnesses, but they might have COVID. So then we'll have to contact trace all those people and where they've been.
Is there anything you can do under your powers as a show to limit international arrivals into Queensland?
No, that is a Commonwealth decision.
Dr. Young, you said yesterday that domestic travellers weren't usually put in the same hotels as international travellers, but the hotels have been under a lot of pressure lately.
Yep.
What usually happens, and have we had increased numbers of international travellers coming in? What is under more pressure?
We returned back to that cap of 1,300, so it was down to half that number for a while, and then it went back up. And so we've seen that steady increase in the numbers, so you can see 190 are coming in today. And they've got to stay there for 14 days. So it's not 190 for one day, it's 190 for the next 14 days, and tomorrow we'll get another 100 or so, and then another. So it just builds up. And that's that increasing pressure. And then we've seen more cases, so we're up to 41 active cases, and they've got to be managed. And most of them now are Delta, and that is just very, very contagious.
So what usually happens? Are they in separate hotels, usually domestic travellers?
We try and split them, but when you're just getting so many coming in, it's difficult. And also some of these domestic travellers are just as much a risk, because they've potentially got the Delta variant. So yes, we do aim to split them between domestic and overseas, but we also try to split the flight crew into their own hotel because they're a risk, and we try and split the maritime workers because they're a significant risk. So we've just got so many different groups that have slightly different risk profiles, and we're trying to manage and balance all of those, and that's what's so difficult.
Just on the AstraZeneca vaccine, what's your advice to Queenslanders now? And did this new shift, is that going to be a HVC or
My advice to Queenslanders today is if you are 60 years of age or over, you should go and immediately see your GP. We have plenty of AstraZeneca vaccine out there, and get vaccinated. If you've had the first dose of AstraZeneca, as I have, then go and get your second dose, because the first dose is the one that has the higher risk. The second dose is very, very, very low risk. So I'm due on the 31st of August, I'm booked in. So work out 12 weeks from when you had the first dose and go and book in today if you're not already booked in, to make sure you get that second dose. If you are 40 through to 59 years of age, then you need to book into one of the Pfizer clinics. So at the moment that's Queensland Health, but it won't be long and GPs are going to have access to Pfizer, so you should then start booking into GPs if you're 40 through to 59. As the Prime Minister has said, if you are under 40, you can go and talk to your own GP if you think you are at a particularly high risk and you want to get vaccinated now. Now, if you're in 1B, so you're at, deemed to be at high risk, so that's First Nations people, that's people with severe chronic underlying conditions, you can already come forward and get Pfizer. So these are fit, well people under the age of 40 who the Prime Minister is saying, if their GP and they have a conversation and believe the risk is warranted, So they need to understand what the risks are. Then the Commonwealth has agreed to indemnify those GPs should that person get any of those side effects that can be quite catastrophic. So the clinical advice from ATAGI is that people under the age of 60 should preferentially get Pfizer. The advice in the UK is that people under the age of 40 should get Pfizer. That's the clinical advice, but there are some people who have been asking to get AstraZeneca, although the clinical advice is that they should not, preferentially should not.
Just to recap, that one unlinked case from the Portuguese cluster, what was the details around that case?
That's the person who works at the DFO and worked at the DFO at the time that that crew member who returned from Portugal was there. So they were there for a 15-minute period between 4 and 4:30 on the Saturday afternoon. Now, this person worked at DFO, but they did not work at Cotton On, which is where that crew member went, and we can't see where that interaction happened. But they also, we understand, that that person who worked at the DFO does know quite a few people who attended that Portuguese restaurant. So we're just trying to untangle all that. We don't know the exact transmission event, but whole genome sequencing is a match, so we know that that person has got it out of that cluster.
Is there any chance that this lockdown could be extended beyond 3 days?
This is day one. I need to see how things evolve over the next 24, 48 hours.
How concerned are you that those family members are sick or already symptoms?
I need a result. Before I get concerned, I need to get a result, so they're doing a gene expert on them as I'm speaking.
Are you expecting more cases in the community now?
I am, but I need to see what happens.
Thanks, everyone.
Thank you.